Thank you everyone for watching our webinar. We wanted to make sure we address all the questions that were posted in our chat window. Here we are with question number 1. Aviation is geared more and more to allow independence in personal building use, while healthcare will most likely need to stay based on caregivers' need as much as the patient and family needs, especially for hospitalization. Oh, that's a mouthful. Big question. What are our thoughts?
Well, I can tell you my thoughts from the aviation perspective is that yes, a lot of what we do is about giving patients the opportunity to personalize their experience and giving them ownership of the experience. And the way that I would look at this for healthcare is that when you look at what the caregiver's needs are, I'm sure that they are fettered by some sort of process or operation, and that gets in the way inherently of providing care. And so really, what can we do to minimize, those binds and give them the ability to address the needs as they would see fit?
The other thing I would say from a healthcare perspective is for the longest time, or I would say traditionally, it's been about the caregiver individually. So like if you're in an inpatient room, for example, you have one nurse manager or nurse practitioner that takes care of you. More and more, what we're seeing is the idea of collaboration. And so finding spaces for them to be able to collaborate among themselves and then provide care to the patient is becoming much more of a space driver than we touched on earlier, decentralized versus centralized nursing stations, for example. Now those are teamwork collaboration areas that include the physicians. It could include specialists. It could include a whole host of things that address the full wellness of the patient, including
the family. I think separating these two as very independent tracks is going to blur a whole lot more in the future. COVID has taught us that people want transparency. They want a whole lot more to be involved in the way their space functions, as well as how they communicate with their caregiver. And I think that's only going to become more and more dominant. So as opposed to those being very separate tracks, it's going to get much more cohesive.
I think one approach, putting our aviation hat on, it's really about finding opportunities. In aviation, there are some functions, boarding your aircraft, that has to be done in a very specific location. That can't be decentralized, right? So it's really about finding the opportunities where you aren't necessarily tied into a physical constraint, to provide that choice, to provide that maximum amount of independence where that exists. And where that opportunity doesn't exist, if you are a patient in a bed, physically tethered to the building, understanding even within that context, what are the opportunities for choice, for independence that you can afford, even if it's in a very kind of limited or controlled way. It's really just kind of teasing out every opportunity for choice and independence that you can.
Great feedback there. Our next question is, there is currently a huge hiccup in the passenger experience, for obvious reasons. Security checkpoints, though needed and understood as standard part of the airport procession, it is one of the most stressful parts of the airport visit. What are some of the ways to alleviate these stressors? If technology-based, will the general population and AJs feel confident enough to embrace these technologies? This is directed to our aviation folks.
Yeah. So two-pronged effort here on this one. One is like the question poses at the end. Number one, we're trying to improve the process through technology. So we're starting to see more advanced security checkpoint designs come out that promise to process people through faster, which then means that they don't have to wait in line in that stressful part of the process. And then we talked a little bit about appointment-based processing. So once again, if that can be incorporated with the AHJ's approval or the TSA's blessing, if you will, that might also reduce the amount of queue and thus the stress. There's also an aspect of experiential design that ties into this.
Sure.
And one of the things that you'll see in some airports, for example, Schiphol will have has a lower wood ceiling over their security checkpoint with access to nature. thus trying to help reduce the process. And in our design for the Shanghai Pudong South Satellite Concourse, we tried to integrate actually auditory cues through the use of bird chirping and things like that to help try and reduce stress. So if you can't do it through technology, maybe there's a way to do it through design.
Great question. I want to just comment on the healthcare piece of it, although it was addressed to aviation. The use of technology and how AHJs adopted. Telemedicine comes to play. Telemedicine was not a technology that's new. It was always there, but the embracement, like the reimbursement agencies, them embracing that was quick, just because of the result of this pandemic, So there are occasions where we feel like, some of those are contingent on things happening around us, which, and AHJs have been responsive for that. So going on to our last question. Airports and hospitals are both important building types within their communities. Are there similarities in how you approach the design from a civic point of view? This is a great question. Yeah. Who wants to take it?
Sure. So one of the exciting things for me about aviation architecture is the civic aspect to it. That manifests itself in a variety of ways. One of the interesting trends that we're seeing is working with our clients, particularly if those clients are tied to a municipality, is thinking about the airport not just as a piece of infrastructure, but it is the gateway.
It's your entry portal.
It is the entry portal. It is the first thing that many people see, and the last thing that people see and experience when visiting a city. So it becomes a symbol of that city, of that state, or in the case of some airports, Changi is a great example. It is in Singapore. It's one of their strongest branding tools, and so we engage in a lot of discussion and visioning with our clients to understand what about their community do they want their building to communicate to the greater world. And this goes beyond just the metrics and the number of gates and things like that. What are the aspects of their community, of their culture that they want to share with the world? What are they proud of? We had fantastic conversations with our clients in Nashville. That's a city that has a very strong brand. It's a city that is known all over the world. And so in our development of the B&A vision, the complete revisioning of their airport, our earliest discussions were really based on bringing those unique aspects of the community to the airport, taking what's great about the city and having them show up in the airport, whether it's food, whether it's music, whether it's arts and culture,
yes.
Which is a very strong component, creating an airport that is not just in the city or serving the city, but is of the city, is a natural extension of all the most positive aspects of a community.
Great.
I think healthcare is interesting. We are a little bit more on the micro scale, right, when we talk about it. It's much more regionally based, but I think that there's a real drive for healthcare to go beyond just being a place for patients, and a lot of clients are acknowledging that the conference room that they rent out for Boys and Girls Club is no longer enough to count as community engagement, right? And so you're seeing things like farmers markets or arts and crafts fairs. This focus on wellness has driven both wellness fairs, but also the opportunity for education to take place and really educate the community on how to be well holistically instead of just trying to tackle it after they've already gotten sick. And I think understanding too that there is a whole population out there who is afraid of approaching a hospital as healthcare. And to truly be civically minded, you have to think beyond that. So you're seeing these amazing partnerships between hospitals and libraries in places like Boston. So they're serving these underserved communities or homeless populations who feel like they'll be on the grid if they go to a hospital. It's that engagement outside of their four walls that is really where healthcare needs to keep going.
And I think tying back to one of the trends that we discussed of the airport or the hospital is one component of a much deeper and richer civic fabric. So it's not just the building you go to if you're sick or where you go to get on a plane, but it's part of a much more kind of holistic civic engagement and civic life that people have.
Thank you, Joel. Thank you, panelists. Thank you, audience, for participating in this hopefully thought-provoking discussion, and hope to see you all next time.